Hi, Dr. Veena. Hope you're doing well.
Yes, very well. Thank you so much.
So, we've seen menopause can be a very challenging transition for women, often impacting their personal and professional lives. It's a phase where we see symptoms persisting for years, some say even decades. So, today we want to explore different ways to manage perimenopause and menopause symptoms at work, and also see how we can ease that stress and discomfort for women.
Okay.
So, yeah. So starting with the questions, I first want to understand what was your experience at work when you were going through menopause?
Right. So there were a few symptoms, but one that really affected me at that point of time was, as you know, during this phase of perimenopause, there are multiple symptoms, and one of the symptom is urinary frequency, which is something most women obviously shy away from talking to others, and they're quite embarrassed to discuss about this. And that's exactly what happened to me also, but with a shift of 10 to 12 hours at work. This was something that affected me a lot, to the extent that because I wasn't ready or willing to talk about it to anyone, I decided to decrease the intake of my water, and that ended up with another issue. So this was something which affected me, and I know of many women who go through this, because this is something that most women will not discuss with anyone. uh,
Hmm.
Urinary frequency, urgency. Some women have leakage of urine, recurrent urinary tract infections. So these are something that women really go through at this stage.
So what did you do at that time?
Exactly, this is something that I learned the hard way. Um, the choice that I took was not the right one, by decreasing my intake of water, because this is the time, or any other time, keeping yourself well hydrated is important. But I adopted certain, after I realized that this is not the right step to take, I decided to use certain remedies which will actually help in the situation. Basically, bladder exercises, pelvic floor exercises, training, bladder training. Basically, that is something that is can be learned. So these are certain measures that you can take. Also, with regards to intake of to stimulants like coffee, decrease taking too many coffees and tea and all that kind of food. Anything that triggers these symptoms, these are some things that I adopted. Yeah,
Okay. Um, we've read that menopause symptoms can last more than a decade, right?
that's
So, uh, taking a break from work doesn't seem to be a solution. So, what do you think can be done?
Yeah, you're right. So menopause is something that can go on, for 8 to 10 years. Perimenopausal phase that can go on for 8 to 10 years. So we can't have a, like a short-term measure for this. You need something like a structured uh, approach to it. And the most important thing is awareness of what and why are you going through these symptoms. As you know, once women understand what is happening to them, they prepare to face it. And then next is take the right approach to face these symptoms.
Okay. So, could you give us some specific tips as to what women could do during this phase?
So since the symptoms are varied, there are multiple symptoms that women go through. Preparation is very important. And how do you prepare for this? So it's not like, as you know, the famous saying that goes, prevention is better than cure, and that the same thing happens here as well. So there are a lot of factors like being active, your healthy lifestyle, nutrition, workouts. These things, I wouldn't say wait for you to, start with your perimenopause symptoms and then do all this. Even while you're in your mid 30s, of course, exercise and lifestyle, healthy lifestyle is irrespective of age. But to reach a stage, to be better adaptive to this stage, it is good to start it earlier and practice it regularly, and you'll be able to cope with it in a better manner if you follow a healthy lifestyle.
Okay. Uh, Doc, we've seen during this phase there's a lot of brain fog, confusion, being forgetful. And obviously there is going to be an impact on at work as well. So how do you think women can handle this?
Right, very true. So a lot of women do go through this, memories getting affected, sudden disinterest in working, or even sometimes waking up from sleep, brain fog, sudden confusion. These are very commonly noted symptoms. So one of the things that I would start with, something which is the most important, which is getting enough sleep. A lot of us do not give it as much importance, but this is the time when we do need adequate amount of sleep, at least a good 7 to 8 hours of sleep at night, making sure that you're eating healthy, work out, but don't overdo it. Work out in the minimal, the right amount of workout that we need. And if you realize that there is a confusion or there's something that you can't recollect, start making notes. Be prepared. If you can't remember, write it down. But again, though I do say write it down and things like that, it is also important that you train your memory. Try to memorize things, meditation, deep breathing exercises. Anything to calm yourself is something that you can practice during this time, that you should practice during this time.
Okay. Mm. So while we asked women to share their problems that they're facing at work, one of the most common things that came up was tiredness at work, and followed by muscle pain. So any suggestions on this?
Right. So, of course, again, this phase, all these are symptoms that we notice, but any symptom that we feel or we experience at this point of time should not be attributed only because of perimenopause. It is important that you get yourself checked, make sure that there is no other health issues, because this is the time where we need to be aware of that. So just because you're in the perimenopausal phase does not mean that everything is related to the hormonal imbalance. So make sure that your thyroid, your blood sugar, your blood pressure, all other parameters are fine. And if everything is fine, then of course, as I said earlier, so a lot of these things that we say how to cope with this phase may sound repetitive, but it is a fact. It is one thing is, of course, sleep, following a healthy lifestyle, making sure that you're well hydrated, workouts, very important, strength training, cardiovascular training, all these are very important during this phase. So, even for muscle aches or joint pains, it is important that women start doing the workouts regularly. It's a lifestyle, it's not something that you do for a month or two and then think that that's enough. It needs to be our lifestyle, and that will definitely help.
So when did you start working out, Doc, and what were the changes that you saw personally in your during your journey?
Right. So I've always been working out, but I saw a major shift in the kind of workouts that used to do before and what I started liking during this stage. So I used to do a lot of cardiovascular. I used to do circuit training, CrossFit, a whole lot of exercises, HIT, all these things. But during this phase, I realized that I was enjoying other forms of exercises. I started enjoying yoga. I also learned some new forms of exercise called Mepadam and Katlakatai, which is a combination of cardiovascular as well as strength training. So the kind of exercise that I did was different.
Mm.
I also maybe initially I used to do at least 6 days of workout. I decreased that. I could, if I didn't feel like that was fine by me, I would do probably 3 or 4 days a week, and that's enough. I mean, we don't have to push ourselves, punish or anything like that. Do what you can, but do something.
Okay. So for women who have never worked out or don't like to work out, so what would you suggest to them?
That's a good question, actually, because sometimes you don't feel motivated to do anything, and that's exactly one of the reasons that I always recommend joining a group class. That's so important, and that's something that I did also, because I went through a phase where I wasn't feeling motivated to do whatever I did alone. I would go to the gym and come back. So it's good to have a community, a group where you can do either a group live class or do an online classes or something of that sort. But that will motivate you because you see others, you develop a kind of a bond with the group that you are in, with your coach. So it's always good to have a group or a community where you can be with others of similar age group, similar interests, and that's a good approach to take actually, and that's something that even I did myself.
Okay. Um, Coming to the last question, and this is one of the most talked about symptoms, which is hot flashes. Now, while we are at home, we know we can probably splash some water or probably change the temperature in the room. But at work, you have a lot of limitations. So how do you manage hot flashes at work?
Right. Definitely, yes. There is sometimes a difficulty because you're suddenly sitting in a meeting or something and you feel the temperature rise, you turn red, and altogether it's a little difficult situation. So one thing is with regards to, as I said before, again I would be repeating it, but of course it is a lot of preliminary preparation. It's not just only when you experience a symptom. So making sure that your food intake is right, try and decrease the number of coffee that you drink or the intake of such drinks that can stimulate these kind of symptoms, or drink spicy food, decrease the intake of spicy food. See what your trigger factors are, when are you developing the symptom, and try and decrease those triggers. Make sure that you're sleeping right. Stress is another thing that can cause this also. So make sure that you're practicing mindfulness, meditation, pranayam, all these things. Besides that, what you can do is take some break from work, go to take a walk in between, have a cool fan next to you, a handheld fan, something that you can keep it in your handbag. Wear more breathable kind of fabric, more cotton or something of, where it's more breathable kind of fabric rather than synthetic clothes. So these are certain tips that will help you.
All right. Thank you so much, doctor.
Thank you.